This next program is going to connect the dots for you between oral health and systemic health. And it's going to introduce you to a new way of imaging that involves no radiation, no danger, no compression, no pain, and it's just as simple as taking a picture. All of a sudden, with the new techniques, you can take a picture of the human body and you can see wherever there's infection, wherever there's inflammation, and you can predict where cancers are growing. You can see them in the breast years before they become apparent with the techniques of yesterday. But what you'll see with the new techniques is how infection in the mouth spreads all the way down through the chest, into the breast, into the arteries, into the heart, and intervention makes that go away. You can see for yourself how you can improve your health through getting rid of the things that are taking it away from you. The mercury fillings, the gum disease, and all the other things that go on, including root-filled teeth or root canals.
I talk about thermal imaging a lot. I talk to a lot of women groups. And I'm so blessed because I am so blessed. You know, the Lord really showed me thermal imaging 25 years ago. I said, I need a job that I can raise my kids. And you know what? He gave me one. And then I could help women. And it's not only a job, but it's a ministry and helping women to understand the benefits of thermal imaging. And it's a great test because, and yeah, I know you've all heard me say this, it picks up disease and tumors and problems in the body 8 to 10 years prior to anything else out there. And I'm just going to share, I don't think I've shared this in a while, but the reason I got into breast imaging, I did thermography, but the reason I got into the breast imaging was that I had a lump in my breast, and I went and I had, my PPO-free mammogram, which really isn't free, but I went and had my PPO-free mammogram, and they found a lump. They always found a lump. From my mammogram, then I had to have an ultrasound, right? Because they found a lump. So the ultrasound said I had a lump. So, you know, the panic that goes through women, you're totally panicked, you're praying, oh God, I'll do anything, So my panic goes through, then I had to have an aspiration, a needle point aspiration. Well, when they were doing the aspiration, they couldn't get in because it had capsulized. Since then, I've learned if it's capsulized, leave it alone. It was capsulized, so then I had to go for a needle point biopsy because they're going to have to get a piece of this lump no matter what. So the next day, I went into Grossmont and I had a needle point biopsy. So you're watching the needle point biopsy on the ultrasound, and the doctor, and I was friends with him, and we were talking, and he's trying to get in, and I'm trying to act really cool, And he couldn't get in, so he's getting tired, I'm getting tired, so he really pushes the needle to get in so I can get done. And he goes through the lump into my lung and collapsed my lung. So now my free mammogram, ultrasound, aspiration, needle point biopsy, 2 days in the hospital. Now it's cost me $7,000 copay to find out it was negative. So what he says, well, honey, it's good because at least it was negative. And that really bothered me because you know what? If it wasn't, where would all those cells have gone? Into my lung. And that's when we went and we got certified to start doing breast imaging and learning more about breast imaging and what the protocol was for it. And you know what? It just opened my eyes. It opened my eyes on how incredible the breasts really are, but how incredible it is to go further with thermal imaging. Because we did the body, that's what we did. We did thermograms of the body and biomechanical and all that. But when you connect the body to the breast, it's amazing. And I always tell women, you're just not breast walking around. So I want to show you this little PowerPoint. Thermography takes a picture of our skin. Our skin is the largest organ in our body, so it's a thermometer for what's going on. And what it does is we're looking for temperature differences. It's connected to the sympathetic nerve system, which is the smallest but really largest, isn't it, in our body? It's connected to all the organs.
Well, yeah, it controls the blood supply to
Right.
the muscle, organ, and gland in the body.
So we're looking at physiology and thermography. Every other test you're looking at geographically. So this shows us physiology. This is the man that discovered we have this infrared radiation that leaves our bodies back in the 1800s. The spectrum that William Herschel invented to pick up those temperature differences. It's come a long way. Its cameras plugged into the wall. This was the first thermogram in 1948. It took 40 minutes to scan this woman. It was in black and white. And isn't that amazing? I mean, how things start. And since then, we know that the military's picked it up. The weather uses it. We watch it on the news stations, how they show the weather. The borders use it. They use it for night vision. It's used so much. Because a lot of people tell me they've never heard of thermal imaging. And I go, yeah, haven't you seen it on the weather? They go, oh, yeah. Well, thermal imaging is used quite a lot. But in medical, when they colored it, they designated each of these colors a Celsius. And that's how they can pick up disease and tumors and problems in the breast 8 to 10 years prior to a mammogram. But the great thing, no contact, no compression, I'm supposed to say hey, yay, and no radiation. And how many women know that every time you have a mammogram increases your chances 5% of getting breast cancer, right? 5%, it accumulates, it doesn't leave our body. So it increases 5%, and they're saying that a mammogram is 1,000 times the radiation of a bone x-ray. This is a thermogram, and you know, I worked in the x-ray department at Harborview Medical Center for many years with Dr. Lee, and you're never going to see this on a mammogram. You're never going to see both breasts, both nipples, stomach, hormone levels, lymph, axillary, thyroid, and carotid. Because you're just not breast walking around. There's a reason there's a problem in the breast. You know, when women come in to me and say, I've had breast cancer, I'm like, oh my gosh, why did you have breast cancer? And they don't have a clue. That bothers me. I mean, is there estrogen dominance? I mean, is the thyroid working properly? Is there hormones? I mean, that really bothers me, and that's why we're so blessed to have Dr. Melvin when he reads these, because, I mean, the information that comes back can save your life. If your estrogen dominance, if your thyroid's not working properly, if your digestive's not working properly, we need to know those things. This is about staying healthy, because a lot of these pictures are going to show us things that are going on in the breast. What we want to do is to teach you how to stay healthy. And we don't, well, I'll show you what other pictures we take. We take anterior, obliques, so you're seeing interproximal, you'll never see that on a mammogram, and you're seeing laterals. And that's so important, because we're seeing all the breast. The thermography picks up a problem at 256 cells, 2 years. A mammogram can pick it up to 3, 4, 5, 6, 7, 8 years. And it's doubled 32 times, and it's gone from 256 cells to over 4 billion cells. So what do you think your chances are better? 256 cells or 4 billion cells?
250.
And yes. This is showing you thermography. This is the first thermogram. We're creating a baseline, but you're seeing the physiology difference. You're seeing the heat temperature difference here. But what we do is we have you come back in 90 days and see how it doubled. And in 1 year, this doubled 5 times. What's wonderful about this, she was never x-rayed and it was never compressed. Because once this is x-rayed and compressed, it can rupture and spread through the body. This is when we pick it up at 256 cells, or when thermography picks it up. Cystic, let's get you on a non-cystic diet. Let's not do any of those biopsies. Let's get you on a non-cystic diet. Anita can help you with that. This is ductal carcinoma. It's one of the hardest cancers to find, and this is 4 billion cells. And here we're seeing the tumor, and it's called neovascularity that's feeding that tumor and looking for the lymph. And we've seen ones like that have shrunk. Once you've changed their diet, yeah, you need to come here. Once they've changed their diet and digested.
Well, see, a lot of the ductal carcinomas, recently they found that they were self-limiting. Have you heard about that? Yeah, a lot of them are. They only grow to a certain point and then they stop. So we have cases that we've monitored where that ductal carcinoma stops, doesn't progress any further. We see an inflammatory pattern that is limiting. It doesn't go any further. Why do anything else other than monitor the process, see how the body is responding to those inflammatory sites, and help them process or digest better, eliminate better, so their inflammatory levels are lower. so they can heal themselves.
Inflammatory breast cancer, this can strike women as young as 18, 19. It's a virus. It cannot be picked up on mammogram till late stages. And what we've done is we're not educating young women about this disease. And it's a deadly disease, and it's a virus. And it will not pick up on a mammogram.
Well, you know, that you've heard about the change in the industry, the insurance industry recommending that mammograms start when now? When? 50 years of age. Why? Well, you think that, but you know what? Because of cost effectiveness, number one, they found that they weren't, Lancet, who does a lot of research regarding the success or lack of success of different therapies out there, found women that were doing mammograms at 40 to 50, there was not a decrease in cancer, okay? There wasn't a decrease because of that. The reason why, number one, the mammogram is difficult to identify tumors in prior to 50 years of age because the density of the breast are such that you don't get a proper image prior to the age of 50. In fact, now there's been attempts of mammograms as young as 30.
Oh my goodness. Well, I've had girls come in and say from their 20s because they had cancer in their family. I go, well, you're going to have it for sure now. So there's so much that contributes to breast cancer or breast problems in the body that you want to diagnose that early so you can start working with the diet, cleaning up the digestive system, and doing these women's health screenings. You're getting a roadmap of how to stay on top of this before this happens. Inflammatory breast cancer in the left breast. Ductal carcinoma. You can see it. This is just a grayscale of this showing you the vascularity of it. But here, look how interproximal that is. That wouldn't have been missed by a mammogram.
Now again, what we're looking for is what feeds the tumor, rather than waiting for the mass to be a certain size to identify the tumor. Do you understand the difference? One is looking for what feeds it, and if there's any changes in the characteristics of feeding the tumor. Sometimes those tumors are self-limiting. They grow to a point and then they stop. Do you want every tumor extracted? Many times what you're doing is just opening a can of worms. Many times they're so well encapsulated that the body has walled it off so much from you that leaving it alone is your best option. Not taking every tumor, not taking every cancer cell out of the body. Everyone to a degree has cancerous cells. What your body does is it walls them off, or it destroys them on its own. What we want to do is increase your ability to do just that.
This is showing you hormonal estrogen dominance in the body, and this is we're picking that up early. Let's get this woman working on on her hormones. I mean, that will change everything. And I work in a female. Yes.
Let me see. What does that mean? Hormonal dominance.
Well, it's estrogen dominance, or they're progesterone deficient. So it's either or. Either in this case here, frequently it's because of the lack of progesterone neutralizing the estrogen, but there are other issues at the same time. Sometimes what this issue is there's a gallbladder disorder and a liver that isn't clearing, assisting the body to clear the estrogen properly.
So is that a cancerous precursor?
No.
Okay.
Well, this is not a cancerous precursor, but left alone with an estrogen dominance, you see how inflammatory it is?
Yeah.
How inflamed it looks?
Yeah.
You would never see this on a mammogram. You would never see it on an ultrasound, because those tests are more geographically oriented. This is a functional test. We're seeing how the blood is being distributed, and we're using 1/2 of her as the standard if what's normal on the other half. So it's more specific about your body. This type of test is more specific to your physiology.
the next picture is implants, and a lot of women, they don't realize when they get implants that when they have a mammogram, it's going to be very painful because they have to move that implant, compress the breast, and put that implant back. And what happens is you can't smush an implant in a vise, can you? So what happens is they end up getting the ends of these, and we see it all the time, and they get leakage, they rupture them. I mean, these women go through heck because of these implants and trying to have a mammogram. But thermography, because it picks up the sympathetic nerve system, can see behind the implant. It's the only test they can. So now these women can have a safe breast exam. Fibrocystic, full blown.
Yeah, this one's pretty active though, so just to leave her like this is still, even though it may be fibrocystic and extremely inflammatory, you can tell that her inflammatory levels are way too high and her estrogen levels are high. So there needs to be something done about this now. But on a mammogram, it's fibrocystic is the diagnosis.
Yes.
Is there
Well,
something?
I have cystic breast. I'm like, oh my goodness.
Yeah, this one is severe. This is a severe case.
What does the white represent there?
Every color is a different temperature. You were asking about the
Exactly.
green.
Yeah.
That's a different temperature.
Well,
The white's the hottest.
Yeah.
It's just
Oh,
warmer
so
there.
white is the hottest.
Yeah.
And this one looks like what she wears an underwire bra also. How many women wear underwire bras in this room? 85% of women that wear underwire bras develop lymph congestion, and lymph congestion is one of the #1 cause in those women for breast cancer. They're killing us, no matter what we do. You know, and the reason is not because of the constriction, it's because it's a wire. So it's like an antenna, and every place we go now is Wi-Fi, radiation, that's all going into that underwire bra, and it's damming up that lymph. Inflammatory around the nipple. Male breast cancer, 1% of men get breast cancer, guys. And one of the things, I set up a dentist in New York, and he's very progressive, and he's gone green, and he's taken out his x-ray units, and he has thermography there, and he drives Dr. Melvin crazy, but we love him. But he's very, very knowledgeable. And the big thing they're talking about is most disease, well, all disease starts in the mouth periodontally. And periodontal disease leads to breast cancer, and you'll see another picture of heart disease. So if we can catch it early, too, with thermography periodontally. If you went to a dentist and he saw this periodontal, do you think he's going to see this? No. Isn't that pretty incredible? So your dentist is going to miss this. This dentist looks in the mouth and goes, you're going to have gallbladder problems, you're going to have pancreas, this is going to, you know. I mean, and he does a thermogram. He sends them right over to the room, and they do thermograms. Remember how they used to, the doctors, they open your mouth, they put the tongue depressor, they look in your mouth and lift your tongue up. When I was a kid, they don't ever do that. They don't do that. It's so important. The mouth is very important.
Doctors, MDs, need to look at teeth. We're not supposed to look at teeth. The demarcation isn't restricted to building sites. And all of a sudden I started looking at teeth. This lady, 53 years old, she had breast cancer. 6 root-filled teeth, 4 of them happened to be on the breast acupuncture meridian. So what are her chances of not getting cancer? She also had amalgams and crown and bridge. And that x-ray was passed by a top dentist and oral surgeon as being okay. But hey, even I can see the problems, plus all the metallurgy. Here's another one, breast cancer, 4 root-filled teeth, 13 amalgams and 3 crowns. Huge problem. I get a patient with an abnormal thermogram that's deteriorating. She's heading towards breast cancer, and they've got that in their mouth. What am I supposed to do? Because it's pretty devastating to the patient to think that I'm going to get breast cancer unless I have all this dealt with. At huge, huge cost. Psychological as well. Let me just show you what thermography is. That's a completely normal thermogram. 52-year-old lady, 53 years old, breastfed children, completely normal. Black is cold, then shades of blue, yellow, red. Bit of thyroid problem up there. Completely normal. There's right-sided breast cancer. Stands out like a sore thumb. There's another one. That lady had completely normal mammograms and ultrasounds. In fact, in the end, I went to the radiologist and I said, if this woman hasn't got breast cancer, I'll sell the camera back to America, $40,000. They got a bit worried and sent her for an MRI, and that picked up the cancer. But this is where we can combine the two professions. Completely normal. She happened to be one of my staff. All my staff are female for some reason. And when I got the camera, everybody had thermograms done. 2 years later, I suggested we ought to do them again, and we got a nasty surprise in this nurse. She had a very nasty looking right breast, which was typical, in fact, of a DCIS, a disseminated ductal carcinoma. The nipple temperature had gone right up to over 1 degree, 1.3. So we intervened. We instigated measures which consisted of removal of a root-filled tooth. Had to be on breast meridian as well. She had her amalgams removed. She went on vitamin C, selenium, DIM, Mullimen, homeopathic. 3 months later, looking better. 6 months later, looking even better. Nipple temperature down to 0.3, so it's normal. So before March it was that, and 1 year later it was that. Basically by including some dentistry and a few other bits and pieces, but the main thing was dentistry. So we've got a tool here with thermal imaging that can make inroads into the commonest form of cancer in women.
This is a women's health screening. This is what I love to do, and I'm probably going to stop here, but I love women's health screenings because this is a great way to start. This is a roadmap, and this is showing you the pelvic, the abdomen, ascending colon, stomach, descending colon, gallbladder, kidney, liver, adrenals. This is a great picture because you're getting the whole story from the digestive to the breast to the lymph to everything that's going on in that body. So I love this, and I always encourage women when they first start to get a women's health screening.
Yeah, these are deep, the deep vein thrombosis, to have this, you can't see it. Easy to see in a thermogram. This is so deep, and yet the skin itself changes the temperature that actually fits that particular vein pattern. I mean, to me, that's amazing.
And these can be deadly, both of these.
Can you tell uterine or ovarian cancer?
Yeah. You won't be able to discern. All we would be seeing is it inflammatory? Is it distended? Are the ovaries cystic? What they'll do is they'll be distended and they'll show a blue rounded pattern that's consistent with the body part that is involved.
Okay, but you can tell there's an involvement.
Yeah.
Okay.
That's as far as we, and many of those cases, what we do is we direct the test, see then to do an MR, because we're seeing suggestive patterns that are significant enough that needs a more geographically oriented test.
Yeah.
You follow?
So it shows you a lot of the precursors, right?
Right, and then it directs you more about what tests are really necessary and what tests are you wasting your time on.
That was chronic fatigue. I get a lot of women in, they're tired, they're exhausted, they have no oomph, everything hurts in their bodies. And so I'll take this picture, and when you see this cold area, this is the T1, T2, this is the vertebrae where the nerves for the immune system come right out of. And I'll see this, and they end up crying, and they want to take the picture of them to their husband because everybody thinks they're crazy.
What the interesting thing about T1 and T2, those are the primary nerves that, as they come up and control the blood supply related to the phrenic nerve. Diaphragm disorders, the control of the diaphragm seems to be consistent with a lot of disorders in general, and we'll get into more of the diaphragm disorders.
Thyroid disorders huge.
Yeah. I mean, they give you that butterfly pattern easily seen on infrared. If they're unilateral, if there's a nodule, what we look for is if there's a nodule, is there any changes in characteristics of the nodule? many of them are self-limiting. They grow up to a point and then they stop. Where now what they're trying to do, every nodule that's there, they want to biopsy. Well, if it's encapsulated, leave it encapsulated. If it's changing characteristics, meaning it's getting larger on the thermogram, then those things warrant more testing. But if it's grown, it's stopped, leave it alone.
And then a lot of people tell me I just had my blood test and explain that, how that medical blood
Well,
test works.
yeah.
Even Dr. Cole has to explain it.
Right, see, the thyroid, when they determine what is normal, what your thyroid levels are considered normal, that's a national average. That is not specific for you. Your thyroid levels may run a different level than the national average. So when we see these patterns, either they'll show up heated up or they'll show up cold. Either one are significant at either hyper or hypo, meaning overactive or underactive thyroid. Many of them, as they get burned out, they're initially hyper, and then once they burn out, then they go hypo. So they're usually trying to keep your metabolic rate, meaning how fast does your body run. When it gets tired, then they go into reverse.
It's just a great way to look at things without radiating and picking up soft tissue.
I
The
see.
feet, the feet tell us a lot.
Yeah, these, as far as disc-related issues, or in many cases they're not disc, but there's nerve entrapments, nerves that are tugged upon. In many cases there's not an IVD or a disc herniation at all, but rather the nerve is being stretched upon. So we can differentiate those particular type of disorders rather than thinking, well, I need to have my disc out, when really the disc has nothing to do with the neuropathy. This is an example of a neuropathy into the left heel.
And so many people suffer with neuropathies, and neuropathies will show up on an X-ray.
The one thing, you see how heated up the right foot is? You would think this would be the problem, right? No? Yeah?
I
Yeah,
would.
it's the one that's hotter, right? Well, because he can't put weight through the left foot, he's putting more weight through the right foot, so he's favoring the side that hurts. So sometimes the one that's colder is the one that's worse, that has more of the pain.
That's a bad one.
Yeah, this is a fracture that didn't heal properly, so it has, basically, it's a sympathetic, this is RSD, reflex sympathetic dystrophy. One of the only tests is thermography that identifies this disorder. So just because they fracture and they heal doesn't necessarily mean they're going to heal properly.
Medicine's enamored with the techniques from 100 years ago. They need to move forward, and you need to demand thermograms. There's no danger to them, and their cost is minimal. There should be one in every drugstore in the United States. Poke a quarter in, get a picture. You could see what's going on in your body. But what you'll see with the new techniques is how infection in the mouth spreads all the way down through the chest, into the breast, into the arteries, into the heart, and intervention makes that go away. You can see for yourself how you can improve your health through getting rid of the things that are taking it away from you.